Thank you so very much for joining us this morning, Doctor. Good morning.
Good morning, Rahma and Safira.
Hello, Doctor.
Nice to meet you. How are you?
We're good.
Alhamdulillah. Okay, now, Doc, we're going to jump right into the first question. Now,
Yes.
could you actually share to us more about this vocal cord injury that we need to be aware of?
Okay. Before we go to the term of a vocal cord injury, maybe first I would like to explain first about the anatomical and the function of the vocal cord itself.
Okay.
So a vocal cord is a V-shaped two bands of smooth muscle tissue, which is found in our larynx or our voice box, located at the top of our trachea. So normally during breathing, the vocal cords will be open or in abduction position.
Yeah.
So when you do the phonation, it will be in adduction position, right? So during phonation, the vocal cord acts as an energy transducer that converts from aerodynamic power generated by our chest, diaphragm, and our abdominal musculature into acoustic power, which is radiated at the lips, that is heard as a voice. So it will vibrate in a very smooth move, right? So when we talk about the vocal cord injury, is a condition when our vocal function disrupted, so it cannot move or vibrate perfectly. So you can complain about the hoarseness when you talk or you sing, right? So in easy way, I can say that a vocal cord is one of the most important but yet underappreciated muscles in our body. Why? Because they can be injured to misuse or overuse just like any other muscles. So people usually more focus on bodybuilding, their bicep, their tricep or abdominal muscle, but they forget that we have a very small muscle which is very important in our daily life. So yeah, I think that's the definition of the injury itself.
I experience this hoarseness or losing my voice when I have to do hosting, Doc, after I got a long cough. It happened like 2 or 3 times, I don't remember, but it always happened after I got a long cough, as I mentioned earlier. So actually, what will be the cause of it? Because of the long cough? Because I keep coughing, non-stop, or is there anything else?
Yes. So actually I can divide the cause of the vocal injury itself into 5 categories. First, maybe which is Safira suffered before, it's an infection. It can cause both from the viral or the bacterial infection. So like when we got an upper airway infection, or we call it a common cold, it can also damage our vocal cord, right? So and the second one, which is also the most common cause of the vocal cord injury, is vocal abuse or misuse, which is often happen in voice depending job, like you as a presenter or a singer or teacher. So it's one of the most cause also for the vocal cord injury. And then we're going to the third one. I can say it's from a direct trauma or a physical trauma, which is it can happen in a situation like during surgery. So when the doctor do the intubation or inserting the tube for our airway, like because we are under general anesthesia, so it can directly give an impact to our vocal cord. Or another one kind of trauma, which is very important too, is a blunt trauma. So a blunt trauma very often happen in the vehicle accident, or if you accidentally bump your neck into or with something, right? So it will be need a close observation, because usually in a blunt trauma there will be no open wound around your neck. So you will think that I'm fine, right?
Yeah.
But
Yes.
the dangerous thing, right, is that it can affect directly inside your throat or your larynx. And usually this is an emergency case, which is you need to go to the ER right away.
Okay.
And then the fourth one is an acid reflux. If you ever heard the acid reflux, maybe some of you, it's a very common problem I found in the outpatient clinic. So in medical terms, we call it Larinopharyngeal Reflux. So the stomach acid travels into your throat, and it can cause your larynx or your voice box become irritated.
Oh, wow.
Okay. And the last one is, which is, I can say it is the more severe form of the vocal injury is vocal cord paralysis. It can happen in one side or both sides of your vocal cord, so it cannot open or close properly. So, but it's usually caused by the head and neck injuries or tumor or stroke or any other certain neurological disorder, maybe such as Parkinson.
Wow.
Okay, very clear.
Losing our voice is not comfortable at all. I can imagine if people didn't recognize what is the cause actually, right?
Yes, yes. Now, Dr. Hamida did actually, point out, occupations and also, what actually we will experience and how, the experience started and stuff like that. She did mention about singers. She mentioned about presenters.
Teachers.
She mentioned about teachers.
Right.
Actually, I was like thinking, okay, so that means people, if I can, sum it up a little bit. So people who are actually like the occupation of talking, let's just say 24/7, right? Such as teacher or presenters or, singers can actually have this kind of damage. Because I was like thinking, Dr. Hamida, obviously I'm a mother, Dr. Hamida. I wake up at 5 o'clock in the morning for subuh, and after that my children will wake up starting at 5:30 in the morning until they sleep.
Yes,
my voice
I'm a
will
mother.
raise up. Seriously, Dr. Hamida, you can elaborate with me.
High-pitch notes is always there, right?
There you go. I was like wondering, can actually, mothers in households like us can have this kind of damage?
True.
So
we need to be careful of that. So.
You have to be careful. I should remind my mama at home.
I know. So kids, please listen to your mother if you don't want your mother to have this, voice damage. Okay. So actually, coming back to the topic, Dr. Hamida, what are the emergency treatments for the vocal cord paralysis?
Yeah, actually, it depends on the cause, right?
Right.
So if you suffer from the vocal cord injury after you overuse or misuse the voice, so first thing first is you need to rest your voice. So stop using your voice because it can help to minimize the friction between your vocal cords.
Wow, that's hard.
And then maybe you can try to gargling warm salt water.
Right.
Okay.
And then maybe if you have a humidifier in your home, you can turn it on. It will help to keep the humidity inside your throat and also the vocal cord itself. Or you can try a natural and soothing lozenges. Lozenges, right? And of course, drink plenty of water is very important too.
Okay.
But if the complaint is not getting improved, so I think within a week or two, the professional medical exam will be necessary.
Oh, okay. So now we get it. The first time is gargling is really important. To stop talking.
Yes.
It means rest.
Stop talking.
Rest your voice. It means to rest your voice, of course, to gargle. And then put the humidifier at home. I think most of the people now have that one at home, especially during the COVID pandemic.
Of course.
And I wonder, what if one people or particular person doesn't receive a proper treatment for vocal cord paralysis? Is that true, doctor, that the vocal cord injury can be permanent?
Yes, of course, because persistent irritation, it can cause more chronic, permanent damage. in a short way, by not allowing the vocal cord to recover properly, so it can cause the vocal cord to develop a callosis or a blisters. We call nodule or a polyps. Like Raffi Ahmad, you know, maybe you heard the news, right? Yeah, he has a problem with his voice. So it will change the sound of the voice, and so usually the surgery will be needed to remove it. But if the cause is from resulting from a direct trauma or a blunt trauma, so if you left untreated or late to be treated, it can be life-threatening because it's a very thin mucosa or a muscles, right? The vocal cord. So once it gets injured, it can become swollen, and of course it leads to airway obstruction. The person cannot breathing normally, so you need to do the emergency like a tracheostomy. So it's very it looks like very simple, but it's very important to know this thing.
Wow, it's really, really important. Right?
Very important, such as, you know, we intend to clean or we want everything to be nice and beautiful and clean for something that we can actually see. But at this point, you know, our larynx, our pharynx, our trachea is inside our body, which actually we cannot see it, right?
But we use it every time.
And then we use it every single time, Dr. Hamida. Now, obviously, just like the floor, because we can see dirt on the floor, we tend to sweep it, right, every single day and then mop it. So it is related with hygiene. But for our larynx, pharynx, and also trachea itself, because we cannot see it, obviously we still need to clean it, right? So this is related to hygiene. So what is vocal hygiene? And actually, how can we improve this vocal hygiene of ours?
A vocal hygiene is almost the same with hand hygiene, right? So we do the hand hygiene to keep our body healthy. So we keep washing our hands to avoid the germs get into your nose or your mouth. So it's the same principle of the vocal hygiene. So a vocal hygiene is a daily regimen of a good habits to maintain the health of your vocals, such as avoid irritants. Irritants that I'm talking about here is like a cigarette. Not only the active smoker, but also the secondhand smoke. And then also there are there are also a food-related acid reflux. So there are certain food which is worsen the acid reflux itself, such as maybe milk. The milk can the thick mucus behind your nose and throat, or an alcohol. And alcohol, for some people, will they think that they sound better after drinking alcohol, but actually it drying up your throat. And then beside the avoiding the irritants, a good vocal hygiene means that we need to have a good hydration. So minimum at least 6 up to 8 glasses of water per day. So it helps the humidity, the moisture inside your vocal cord. And then adequate vocal rest. So you need to avoid the improper use of the voice, such as screaming or unnecessary loud speaking. Such, of course, we as a mother, this cannot be avoided, right? So those things. Those things that we call it with a vocal hygiene. So it helps to maintain the health of your vocal cord.
One more thing, Dr. Hamida, before we say goodbye and give the conclusion from the talk show. You mentioned about to take care the muscles inside our throat. People tend to only focusing on bicep, abs, and something like that, something that we can actually see. So is there any exercise that we can actually do daily for our throat? So it can be the prevention to get the injury.
Just like any other muscle, we need to warm up our vocal cords also, especially for people who have a voice-dependent job, right? So maybe like if you ever heard like yawn side technique, and then or humming, something like that, and then or lip buzz or a vocal straw exercise, something like that. Actually, it can help to warm up the vocal cord itself. And also for a job like a singer, there are certain notes that you cannot use your vocal cord harshly, but you need to some technique like head voice. Head voice. Like maybe you remember that Meghan Trainor or Adele, they are suffering the hemorrhage of the vocal cord, right? So I'm a fan of Adele, so I know that
you follow the story, Doc.
Yes, I follow the story because if you notice that the first album compared to the last one, she used more floaty head voice rather than the earlier one. So this technique is also help to protect her from voice problems. So,
nice.
Yeah, warming up is very important for that kind of situation.
So I think we have to implement things before we do the show, Rahma.
Yes.
To the humming, to the exercise of our throat, but lip buzzing, doing the monkey face, we have to take good care of our throat because this is one of our assets.
I know,
right?
I know. Okay.
Thank you so much, Dr. Hamida. It's really enlightening us now, enlightening us about the vocal cords. So hopefully we didn't get any injury anymore.
Hope not.
Or I'm not going to lose our voice.
Okay.
So, thank you, doctor.
Yes, thank you, Dr. Hamida.
Thank you for having me. Okay.
Bye now.
Bye.